This presentation is designed to provide a preview of the content and flow of the ADEX Restorative and Periodontal Examinations. The treatment, patient, and candidate depicted here are simulated for purposes of demonstration. Candidates are reminded that clinic rules, including infection control protocols, must be followed. Good morning. It's exam day. Your school will let you know what time to arrive. The first thing you need to do is set up your operatory. Bring in your assistant and seat your patient. There are several forms, including the chairside assistant form, patient consent, and medical history.
If you can just answer my questions.
Okay.
What is your...
Review the medical history with the patient and take their blood pressure. The patient can sign, and you will initial the history form. Next, complete the appropriate progress form for the procedure you're doing first. Be sure to note any unusual conditions affecting the tooth you intend to treat, such as rotation, which may necessitate alteration of the preparation. If you're doing an anterior and posterior lesion on the same patient, both lesions can be approved at the same time. When you're ready for the clinic floor examiner to give you the go-ahead, sign in at the CFE desk, and one will come to your operatory. They'll check your paperwork and give you the okay to submit your patient for lesion approval. The CFE will have a runner take your patient to the evaluation station. Once dismissed, a CFE will bring the patient back to you.
Thank you.
The CFE will let you know if your lesion is approved. Now you may begin treatment. Prepare the tooth to acceptable dimensions. If the tooth needs no other modifications, make sure an isolation dam has been placed. Call over a CFE and they will request a runner to take your patient to the evaluation station. If the prep needs modification beyond acceptable dimensions, complete the modification request form in the white envelope. Note any and all modifications separately and call over a CFE. Any number of modifications can be requested at the same time. The CFE may approve removal of pre-existing material. They will review and approve the form, place a red dot on your progress form, and call a runner to take the patient to the evaluation station. The patient will return with a CFE. A green dot now lets you know that your patient was evaluated at the express chair. The CFE will review the modifications that have been approved or not approved. Make the modifications. If you wish to place a liner, note it on the progress form. Once complete, call a CFE to have the runner take your patient to be evaluated for prep approval. A CFE will bring your patient back and let you know if you can proceed to restore the prep or communicate findings from the evaluation station.
I do.
He or she may have an instruction to candidate form. The CFE will have to check any liner that you have placed. Once the prep is approved, you may restore the tooth. Once complete, request a CFE and a runner will take your patient to be evaluated again. The patient may have to wait a few minutes. This is when grading takes place. The runner will return the patient, and then the CFE will again review the communications from the examiners with you. The patient could be dismissed at this time, or additional treatment may be required. Clean your operatory for your next procedure. Repeat the entire process. If you're performing a second lesion on the same patient, make sure a CFE confirms you've taken the patient's blood pressure again before beginning the process. Remember to dismiss one patient before beginning another. Only one patient may be seated at a time. If during the preparation process of any tooth, you anticipate a pulpal exposure, notify a CFE and your patient will be taken to the express chair. If an exposure occurs, fill out a new modification request, and again, a CFE will take your patient to the express chair. If handled properly, the case may not result in a failure. If the CFE hands you an instruction to candidate form telling you to temporize the tooth, proceed as directed. A follow-up form will be generated to inform your patient of any required treatment.